Are you preparing for a nursing job interview and feeling nervous? Don't worry, you are not alone. Those jitters you're experiencing are more common than you think. These feelings of anticipation and anxiety are normal, especially when you're gearing up for an opportunity that could shape your career. But here's the good news. With the right approach and preparation, you can navigate this process effectively. So take a deep breath and buckle up. Stay tuned as we break down the process of acing a nursing job interview into clear, manageable steps. Firstly, understanding the organization you are applying to is crucial. You might wonder why. Well, it's because knowing the organization's values, mission, and culture can significantly enhance your chances of acing the interview. It's like knowing the rules of the game before you start playing, so where can you find this information? It's right there on their website, in the About Us or Our Mission sections. You might also find useful insights on their social media pages or in news articles about them. Now, how do you use this information? Use it to align your skills, experience, and aspirations with the organization's mission and values. Show them that you're not just a great nurse, but also a great fit for their culture. You can also use your research to ask insightful questions during the interview, showing them that you've done your homework. Remember, knowing your potential employer inside out gives you an upper hand and helps you tailor your responses during the interview. Secondly, get a solid understanding of the job role you are interviewing for. This means going beyond the job title. Delve into the job description, dissect each responsibility, and the skills they entail. Is it a role that requires exceptional teamwork? Or perhaps it's one that necessitates expert knowledge in a specific area of nursing. Once you've analyzed the job description, reflect on your past experiences. Think of instances where you've demonstrated these skills, whether it was during your time in nursing school, during your internship, or in a previous role. For example, if the role requires proficiency in patient education, think back to a time when you helped a patient understand their diagnosis and treatment plan. Use these examples in your interview to illustrate how your experiences align with what's expected in the role. Remember, the more you know about the position, the better equipped you are to prove you're the right fit. Next, prepare for the interview by practicing common nursing interview questions. This preparation is key in helping you articulate your skills, experience, and dedication to the nursing profession. Let's start with a few examples of these questions. You may be asked, why did you choose nursing as a career? Or perhaps, can you describe a time when you had to deal with a difficult patient and how you handled it? Other common inquiries might include, how do you handle stress on the job? Or, what's your greatest strength as a nurse? Your responses to these questions should be concise, honest, and should highlight your skills and experiences in nursing. Remember, the aim is not to memorize answers, but to be prepared to discuss real-life situations and how you handled them. Now, let's talk about the STAR method, a technique you can use to structure your responses. STAR stands for Situation, Task, Action, Result. Firstly, describe the situation. This should be a specific instance from your past experience that is relevant to the question. For example, if asked about handling a difficult patient, you might talk about a time when you cared for a particularly challenging individual. Next, discuss the task. What was your responsibility in that situation? Were you supervising other nurses, or were you directly providing care to the patient? Then, detail the action you took. Describe the steps you took to address the situation. Were you able to de-escalate the situation calmly? Did you use specific communication techniques? Lastly, share the result. What was the outcome of your actions? Did the patient's condition improve? Did you learn something that improved your nursing practice? Implementing the STAR method in your responses will help you provide thorough and thoughtful answers. It not only demonstrates your nursing skills, but also your problem-solving abilities and your capacity to reflect on your practice. A well-prepared response can make all the difference between a good interview and a great one. On the big day, dress professionally and arrive early. You know the saying, first impressions last, and in a job interview it's no different. The way you present yourself can say a lot about your professionalism and attention to detail. So, don a well-ironed uniform or a neat business suit. Keep your accessories minimal and your shoes polished. Remember, looking the part can make you feel the part too. Now let's talk about punctuality. Arriving early gives you time to gather your thoughts, to breathe, and to prepare yourself mentally. It shows your potential employer that you respect their time and that you're serious about the opportunity. Plus, it gives you a chance to observe the environment and get a feel for the place you might soon call your second home. Remember, a good first impression can set the tone for the rest of the interview. So, make it count. Finally, don't forget to follow up after the interview. Your job isn't done when you walk out of that interview room. Following up is a crucial step that many overlook, but it can make a world of difference. It shows your potential employer that you're genuinely interested in the role and respectful of the time they've invested in you. When crafting your follow-up message, keep it professional and succinct. Thank them for their time, reiterate your interest in the position, and highlight one or two key points from your conversation that stuck with you. This not only reinforces your keenness for the job, but also demonstrates that you were attentive during the interview. Remember, timing is key. Aim to send your follow-up email within 24 to 48 hours after the interview. This keeps you fresh in their minds without appearing too pushy. A well-crafted follow-up can leave a lasting impression and could be the deciding factor in your favor. To recap, succeeding in a nursing job interview requires preparation, practice, and follow-up. So remember to research the organization, understand the role you're applying for, and practice common interview questions. Dressing professionally and arriving early are also crucial factors. Lastly, don't forget the importance of a follow-up after the interview. Remember, preparation breeds confidence. With these steps, you are well on your way to acing your nursing job interview. Good luck!